That is, the head count of the staff is 18 people. And now, the most important thing is that we were set up as an avenue that will enable well-meaning individuals and groups to incorporate bodies to help if that's what they feel like doing. So anyone who wants to help, and I'm still in my fundraising mode, anyone who's still willing to help because the COVID-19 is still around, the money comes to they can pay the money to our account at Bank of Ghana or come to the office of the COVID-19 National Trust Fund. And even though it says to receive other monies or resources contributed or donated, well, we haven't yet received any such other monies. Our monies come from voluntary sources only. Now, the mandate, and that is our legal jurisdiction, is to complement the efforts of the government in fighting the pandemic and to support needy and vulnerable persons who were infected or have been affected, because those are two different states of being by the COVID-19 pandemic. And then to also support individuals and institutions who have been engaged in the combat against the pandemic. And any other matter, we haven't yet done any other matters. So, for example, the institutions engaged in the combat, we have been supporting, on and off, we've been supporting, for example, the Noguchi Institute. We have been supporting various health centers, and there have been times when we have supported health centers which are not necessarily in the public sector, but in the heat of things, they had also become treatment centers receiving people who had been infected. Now, the Board of Trustees is made up of myself, Archbishop Akuffo, Mrs. Elsie Awati, Mr. Jude Buckner, Mrs. Gifty Afeni Dazi, whom I think she's very much one of you. I always see her as an embodiment of journalism in this country. Dr. Ernest Ufori-Sapong, Dr. Abdul Samid Tanko, a cardiologist at Kolebu, and Dr. Collins Asari, who's our administrator. So this is us, what we have been set up to do, and this is how we do it. And we have been receiving cash donations, cash stroke check, hardly cash, because we don't encourage that. Rather, what has been happening is that people go and pay into our account at our account. We have only one account, really. Our account is with Bank of Ghana, and Bank of Ghana has appointed CBG and GCB and Consolidated Bank and Commercial Bank. They have been appointed the agents, the receiving agents for Bank of Ghana. So, because they have nationwide coverage, and so monies are paid there into our account. And so most of the time when people would see all those ceremonies, the money has already been paid, and then we just going through the action. And so as at 30th June 2022, and that was the height of things, we had actually collected or we had received 62.329, 62,329,941 cedis, 98 pesos. Never forget the pesos, they add up. And particularly at the heat of matters, we had also received a whole range of in-kind donations, sanitizers, cleansers, cleansing equipment, the various types of dry foods, drinks, you name it. We received rice, pasta, and so on and so forth. And then quite a number of vehicles. We received quite a number of vehicles. And this sets out the various types of in-kind gifts that we received, even fuel coupons and so on and so forth. And some of the use to which we put the fuel coupons were that when we made donations and the organization to which the donation is being made, the hospital, the testing center, or whatever, if they had to come in from out of town, we helped them with their transportation, with the giving them some of the coupons. And I think for us ourselves, no, we did not give ourselves any of the coupons, and unless we're going on official assignments. So the donations we made donations to the Noguchi Institute. I've mentioned the Noguchi Institute. We made donations to the various COVID-19 care management centers in the heat of things that were set up. But as time went on, we realized that, yes, these care centers are there, but there are other health facilities where that's where the person was diagnosed to have COVID-19. As to how they were going to be treated and how they were going to be handled, you needed also to make donations to such places so that right from the start, you're protecting the medical staff and you're also protecting the users of the hospitals, clinics, and so on and so forth. So in the end, we made distributions, particularly of PPEs and sanitization materials and all those essential things to so many different institutions, including going to what I considered the real front line, which was the CHIPS compounds, because when somebody had fever or couldn't breathe and was sent to a CHIPS compound, there had to be protection there as well. So the vehicles, we donated them to hospitals, care centers, testing centers, and so on and so forth. There was an ambulance which we donated to Ga East, which was one of the really busy centers because of its location. And later on, when the infectious diseases center was also completed, we've been helping out as required. But really, across the nation, we did distribute these vehicles as needed. And for ourselves, I think, we used one briefly and then gave it away to the NCC, who were doing who also started helping us with the education aspect of the work we do. So the vehicle so we had some in Chenchema we were using for a very long time till we finally we bought ourselves 3 vehicles, which are duty vehicles, particularly for work outside the city. Because, for example, right now, Peter is overseeing a project that we are doing in Cape Coast, for the Cape Coast region, the Cape Coast Teaching Hospital. We're helping to rehabilitate a building for COVID and also for infectious diseases, and so that's what we do. So all the details are there, and I'm not going to read all those details, it will be too boring. But everyone who wants what we're doing, everything on pen drive, they'll provide. If you bring your pen drive, they'll give you the information. I had hoped we could get it done real high tech and put that thing, what's it called? That code, QR code. Oh, they've QR coded. Okay, so there's a QR code somewhere. So those of you who know about those things, I learned about that only last week. I'm 72, going 73, so I'm excused. Yeah. So you can have it, because as for information, the more you have, the more enlightened you become, and the more discerning you become. And so as at 30th June 2022, the amount that we have spent on various things, the total amount we have spent, including even administrative costs, is 53,230,805 cedis and 37 pesos. And then we really go through details as to what activities these were spent on. I will only highlight some, because some, not even all of them are here, because this morning I even remembered that some of those that we did have not been captured here. But in terms of me, I like to go into tiny little details, but the basic ones, yes. One of the most important ones that we did, because we had just been set up, we were a new institution, we were coming into being, and yet we had to be in a position to be helping out, to be carrying out our responsibilities. So we needed to procure protective PPEs. This was in the heat of things. And they were not available to be bought off the shelf. And in any case, there was the Procurement Act and this and that. Even getting ourselves registered as procurement entity took forever, if you take the relative period of time we were in. So the board took the decision that since there was we needed these things urgently, we would use the auspices of the private. There was also a private sector COVID-19 fund that was set up by people from the private sector for their own operations. So we asked them to function as our agents under an agreement. And so they purchased on our behalf and delivered to us. In fact, when the delivery was being made, even where to store was a problem. So we had to fall on the military and use some of their storage spaces. We used storage spaces at the State House and so on and so forth, but we never lost control of our own things because we were counting every single item. And so between April and December, we were able to distribute about 10.25 million CD worth of PPEs and other materials. When we say PPEs, it's not just this, but it's the gloves and the face shields and so on and so forth. And so we were able to do this across the country. 8 testing centers, 9, all the regional and municipal district hospitals, etc., and 126 CHIPS compounds. We were able to do all that. And then we then found out that the body, our private, that private cousin, they're not our sisters. It's not a sister body, it's a cousin. They were in the middle of also building an infectious diseases center for for Accra. So and it was, they had decided that as soon as they were ready, in fact they were planning to finish within a matter of a matter of 3 months, so that they could be taking in the COVID-19 patients. In the end, it took a little bit longer than that, but by June, was it June? Doctor? July, yes, they had finished. So they at a certain point in time, they had they were short of money to be able to complete. And so we donated 6.8 million CDs to them, and it was completed, and they were able to complete and open. And so many people's lives have been saved in that center, and it's state of the art. And any of you who passes by, please go there and take a look at the way infectious diseases centers ought to look in this country, so that people will be amenable, because really we need more than one of that sort. We need one in each region. So this one is sited next door to the Ga East Medical Center. And so, well, I like to say that they've named the lab and one of the wards after the COVID-19 National Trust Fund, because time will come when we will be just history. And so they will know that once upon a time there was a COVID-19 virus which did horrible things, and there was a trust fund, and they made contributions to that center. Another one that I really feel very proud of was when we were suddenly informed by the Ghana Health Services about the shortage of reagents with which to do the testing even at the main testing centers. And so we were able to meet and decide that, yes, okay, we will. This is support. This comes under supporting the persons and institutions engaged in the combat against the COVID-19 pandemic. So we made donations in that regard. 5.5 to Noguchi, 1.9 to the vet services. And some of you may wonder why vet services, were the animals also catching COVID-19? No, they weren't. That was the question I first asked till I found out that was also a testing center. It's a very important testing center, especially in other parts of the country. So we gave them something. And then another one that we did was we were approached. Normally, we are approached, then we study the request, and then decide on whether we will or we will not. So it's not every application that gets granted. But sometimes too, we see a need, and then we ask them, do you need us? And if they do, then we formalize a relationship and see what we can do. So we sent 8 million cedis to support they wanted much more than that, but we've always been very, I won't say parsimonious, we've been taking care of the money in a very Presbyterian sort of manner. So we gave 8 million cedis to the reopening of educational institutions coordinating committee to purchase PPEs and sanitizing items and gels and things like that to enable the reopening of the tertiary institutions. And what you must note is that when we give these donations, in most cases, we agree that for your activity, this is how much we're giving you. But then we need to deal directly with your suppliers. You procure your suppliers, and then we pay the suppliers. So these monies went to, they were making cloth masks, reusable masks mostly, but we also some of the disposable ones. But for example, we got copies of invoices from GTP, from ATL, because they're making the cloth, and then invoices from the sewing company and things like that. That is how we do our thing. And throughout, we were also concerned about ensuring that public education, public awareness is at the proper level, and so from time to time, we would team up with a body that we think is effective in public communication. The NCCE was the first one that we dealt with, because they also have offices in every district and so on and so forth. So they had offices in districts, but to move and to be able to be heard was part of their problem. So we gave them quite a sizable contribution, which enabled them to rehabilitate some of their vehicles and equipment, and we actually also gave them some vehicles to enable them go into the hinterlands and wherever it was needed to give out the message about masking. At that time, it was the masking and the distancing and the sanitization of hands that was most crucially important, because the vaccine had not come in yet. By the time the vaccines came in, we had also teamed up with the National Commission on Culture, and we enabled them to mount so many puppet shows in public places like lorry stations and markets and school parks across the country to educate people on the whole gamut of the protocols, including vaccination. And Ingenious Africa, which is a production company, we teamed up with them for more educational materials on TV. And so they had a series called Corona Life, which deals with so many aspects of the pandemic in interesting ways that will capture the imagination and stick the message in your head. And our surveys show that the impact has been very, very good. Particularly also the impact that the National Commission on Culture made was so good that we did, I think, 3 series with them. And the feedback has been good. We've also teamed up with the National Road Safety Committee and Authority, and that one is on an ongoing basis. And so they mount their programs from time to time, and then we make our contributions of items. It's mostly of items, sanitizers for the vehicles and masks and so on and so forth. And for me, one of the most significant contributions that we did make, that one we made it last year, was paying for the laying of pipeline to connect the, I still call it Ridge Hospital, Greater Accra Regional Hospital, Ridge Hospital to some of us. Yes, it had been renovated to very modern standards, the main part, and it had its own, and it does have its own oxygen production facility. But unfortunately, that facility was not connected. It was connected to the new building, but it's not connected to the older parts of the hospital, which is where the COVID-19 center was. And who needed more oxygen than them at that time? And the only way they were receiving oxygen was buying it in the bottles, very unhygienic, buying it in the bottle and then bringing it to the patient's bedside. And if you consult any doctor, they'll tell you there's a lot of risk in that method of oxygen supply. And so when we were approached, we provided funding to lay a pipeline directly from the production place to each bed, to the ICU, to the intensive care unit, to each bed in the ICU. So now anybody who is in that ICU and needs oxygen gets it directly from their bed. And according to the hospital, this has saved them so much money in terms of the cost of bottles of oxygen. Okay, so I can also talk about some, there are all kinds of big and little ones. I will mention a little one that is also close to my heart, because out of the blue, we received a passionate appeal letter from a family who were distressed because they didn't have money to pay for the bill of their deceased relative who had died from the COVID-19. And after investigation, we don't just jump on sentiment. We looked into it, and we paid the hospital bill for that person. And I was mentioning the ongoing project of the Cape Coast Teaching Hospital rehabilitation, which had been overtaken by, it was the treatment center, but there was a flood and everything things got damaged. And so we are in the middle of doing that. I think it's about to be completed. No? It's 70% complete, yes, because the nature of the problem was more than the destroyed building. There were other issues in the grounds, which if you don't tackle it, you will have the same or even worse disasters happening. So those had not at first been captured in the design, but it's been captured in the design. But the amount we have committed ourselves to remains the same. We're not going to increase, to escalate it. We don't do escalations. And then one of our most recent activities, from the time we were set up, I was always wondering, I was always optimistic that before COVID-19 pandemic is over, there will be a major discovery, innovation headed by Ghana, and we will come up with something that everybody will also want. So I kept telling people, yes, it's a terrible thing that has happened, but we should also be looking for the opportunities. So we have been sort of keeping an eye on what's going on at the Center for Plant Medicine Research at Akuffo, Mampong. And we started hearing about some preparations that they had made and so on and so forth. And finally, they approached us, and we signed an agreement with them 2 months ago, about 2 months ago, for further research and development into two particular preparations, which one of which, the beauty of it is that it works broad spectrum, and was originally developed for malaria, but is also very efficacious for dealing with COVID-19 symptoms, because it brings down the inflammation. I hope I have presented that properly. Yes, that's how it was explained to me. Pardon? And it's also an immune booster. Thank you. All right. And in terms of the in-kind items, orphanages, because we came to an agreement with the Ministry of Gender and Social Welfare, Social Protection, that we didn't want to be duplicating anybody's effort. So in the heat of things, when people were being fed and there were feeding points and all that, we wanted to know, okay, where can we go where we will not be repeating what you're doing? And so they said we should deal with the orphanages, and gave us quite a list of the approved orphanages, and we gave almost all the items to them. But in all cases, because no one, even up to now, knows when we will truly be away from the COVID-19, when it will cease to be a pandemic, when it will cease changing its character, and then you don't know how a particular variant is going to behave. We've been careful not to just give away everything that we have. But in terms of the food items and the drinks, our warehouse is empty. But we gave to the aged, we gave to Help Age, through Help Age. We were also approached by a family. Once again, these human interest kind of situations, a particular family, they wrote to us that they are such and such a family. They are very well organized. They have X number of aged people in the family, so many children, and so on and so forth. They need, they'll be happy to have food items to distribute. And I liked their feedback because they took a video of the distribution that they were making and then brought us the video. And it's something I'm very, very proud of. So, yes, and then Apiate, you know, sometimes when certain things happen, we anticipate that people are going to bunch together. If any one person has an infection, you're going to get a spike in that community. So when the Apiate disaster explosion took place, we decided to send PPEs and sanitization things to the village. And in fact, with those distributions, that's on page 15. Takwa Municipal Hospital, Bogosu Health Center, a certain hospital, and then the displaced persons camps that were all over the place, including at Apiate itself. So we sent things there. When there was the tidal surge, which suddenly one night displaced so many people along the coast, we anticipated, and working with NADMO, we sent things to them. But most of the time, even when we work through another agency, we are there looking over their shoulders to make sure that things are going where they should go. So at Apiate, for example, two of our staff had to go there and hand over the items to the intended targets. So with all that, our current balance is 9.09